Hello everyone, this is the second part of pediatric general examination, which is examination of certain part of the body including fontanelle, eye, mouth, hands and feet. Starting with fontanelle. This is the anatomical position of fontanelles. We have 6 fontanelles, but clinically we examine the anterior and posterior fontanelles only. Before examination, ensure that the baby calm and at 45 degrees because crying and supine position may cause falsely bulging fontanelle. Start gently by middle and index finger and focus on the shape, size, and the tension of fontanelle. Normally, the anterior fontanelle diamond shape, 2.5 cm length and width, flat or slightly depressed, while the posterior fontanelle triangular in shape. This is a normal pulsatile fontanelle. Closure usually by 9 to 18 months of anterior fontanelle and 2 to 4 months of posterior fontanelle. Closure before 6 months indicate craniosynostosis, and closure more than 18 months indicate ricket or hypoparathyroidism. This is a depressed fontanelle, maybe due to severe dehydration, and this is bulging fontanelle due to an increased intracranial pressure, whatever the cause, maybe hydrocephalus. Eye examination. Firstly, start with inspection of the eye for any anomalies, then start the examination for jaundice of upper sclera under the sunlight, and this is very important point, and examination of a pallor in the lower conjunctiva gently. In case of normal eye examination, it is very important to mention there is no jaundice, no pallor. And no need to mention other points like no blepharitis, no glaucoma, no cataract, or no something wrong. Only mention no pallor, no jaundice. Unless there is anomaly, you should mention it and describe it. We talk about mouth examination. The most important points in mouth examination are central cyanosis and hydration status. In case of cyanosis, look at the lips and the tip of the tongue which turn blue. While in case of dehydration, there may be dry mucous membrane, fissured tongue, and cracked lips. Also, you should look for any another anomaly in the mouth, including dental caries, oral thrush, gingival abnormalities, malalignment of teeth, congenital anomalies like a cleft lip and a cleft palate, and so on. About hand examination. Starting with inspection of the hand, especially the nails, for any anomalies, including koilonychia, spooning of the nail due to iron deficiency anemia, and leukonychia, white nail, due to hypoproteinemia, but the most common cause is trauma. Also inspect the nail for clubbing. Normally the D1 less than the D2, so the ratio less than 1, while any clubbing D1 increases over D2, leading the ratio more than 1. The second step in clubbing examination for fluctuation of nail bed, which is normal in this patient, and also Shamroth sign, which is normal also in this patient, or negative Shamroth sign. Positive Shamroth sign occur when there is obliteration of the angle. Also inspect the hand for any abnormality, including genuine lesion and osseous knot that occur in infective endocarditis, and inspect the creases for single palmar crease and examination of pallar. Compare your creases with the patient crease, considering that your creases is normal. Also examination for tremor. about feet examination. Examination of lower limbs in general examination is for edema, starting from the lowest part of the lower limbs, the dorsum of the foot. Just press for 10 to 15 seconds over the bony prominence, usually the head of the first and second metatarsal bone, and observe for any indentation or pitting. Don't forget to examine both limbs. Edema examination in this baby is negative, so you can just mention your finding the edema is negative. In case of edema is positive, you should mention 4 important points: whether it is pitting or not, whether it is symmetrical in both limbs, the level of edema in the lower limb, and should examine other sides of edema, other sides rather than the lower limb. Level of edema in the lower limb, starting from the dorsum of the foot, then to the medial malleolus directly on the bone, then medial shin just above the medial malleolus, anterior shin, and up to the level below the knee, and finally above the knee. To examine the other parts of the body other than the lower limb for edema, pelvis, abdomen, chest, and periorbital area. In the pelvis, examination for edema in the sacral area and in the scrotum in male and labia majora in female. Then the abdomen examination for ascites and the chest auscultation for pleural effusion. You may find decreased breath sounds, pleural rub, and bronchial breathing.